Hello. Today I will be performing a complete SCAT6 examination on an athlete with a suspected concussion. Throughout this demonstration, I will provide patient information, patient instructions, and instruct them exactly as I would during a real evaluation. I'll also include voiceover explanations describing what is being assessed and how the scoring is documented. This section in the SCAT6 documents the basic injury information and establishes the timeline of the concussion assessment. At the bottom of the first section, the examiner will fill in their name and you will fill in the rest of this information with your athlete's name and personal information. Hello, how are you doing today?
Not great.
I'm sorry to hear. So, our first priority is identifying any life-threatening conditions that require immediate emergency medical care. So, if any of the following red flags are present, then the SCAT should be immediately stopped and the athlete should be referred for emergency management. So, I'm going to ask you a couple of questions of symptoms that you may have experienced since you got hit. Have you experienced any neck pain? Are you feeling any neck pain?
A little.
A little bit? Okay. Did you have a seizure?
No.
That you could recall of?
No.
Are you experiencing any double vision?
Yes.
Did you lose consciousness at any point?
No.
Okay. Have you had any vomiting?
No.
How about any confusion?
No.
Good. Have you experienced any weakness or tingling or burning in more than one arm or in your legs?
No.
Okay. Are you experiencing weakness in general?
No.
How about headache?
Yes.
Okay. If any red flag is present, again, we stop the SCAT6 and emergency management becomes the priority. Next, I'm going to assess the athlete's level of consciousness using the Glasgow Coma Scale. The GCS evaluates eye-opening, verbal response, and motor response. So a fully alert athlete will receive a score of 15 out of 15. During your patient interaction, this is just something, as you're asking your athlete questions, you can see if they're having an eye-opening response. If needed, you could say, "Can you open your eyes for me?" Excellent. I'm going to ask you a couple of questions. Can you tell me your full name?
Samantha Guerreri.
Do you know where you are right now?
Yes, the athletic training room.
Excellent. Can you tell me what happened today?
I went up for a header and collided heads with another person.
As the athlete delivers a verbal response, they would receive a 5 out of 5 in scoring. Can you squeeze my fingers, please? Great. With your other hand, can you squeeze my fingers? Great. Can you move both of your arms?
Yes.
And you can move both of your legs?
Yes.
Excellent. A GCS score below 15 following a head injury may indicate a more serious neurological injury and requires further medical evaluation. Some observable signs are witnessed directly by the examiner, while others may be obtained from coaches, teammates, officials, or video footage. Next, we're going to complete the Maddox questions. I'm going to ask you a few questions. Is that all right?
Mm-hmm.
So, in regards to today's game, what venue are we at today?
We're at Castle High School.
Excellent. Which half or period is it now?
It is the second half.
Good. Who scored last?
We did.
Excellent. What team did you play last week on Tuesday?
Village High School.
Excellent. Did your team win the last game?
No.
The Maddox questions evaluate orientation specific to the sporting event and are often more sensitive than general orientation questions immediately after injury. The next step in the SCAT6 is to complete an off-field assessment. This is going to be done in a distraction-free environment with the athlete in a resting state after completion of the immediate assessment in NeuroScreen. You'll have them fill out step 1, which is the athlete's background. These are 5 questions on the athlete's medical history, current medications, and if they've been diagnosed with certain conditions in the past. The second step is going to be to complete a symptom evaluation. You will ask the athlete to rate their symptoms based on how they feel now, with 1 representing a very mild symptom and 6 representing a severe symptom. There are additional questions as well, which are if their symptoms get worse with physical or mental activity. Once completed, you can take the score of the symptoms and the symptom severity. The next part of the SCAT that we're going to complete is cognitive screening. I'm going to ask you some orientation questions. Are you ready?
Yes.
Can you tell me what month it is?
July.
What is the day today?
The 8th.
Excellent. Do you know what day of the week it is today?
Wednesday.
Great. The year?
2026.
And the approximate time?
5 p.m.
Excellent. Next, we're going to move on to immediate memory. I'm going to read a list of words, and after I'm finished, I want you to try to repeat as many as you can back to me, as you can remember them in any order. It doesn't need to be in the order that I read them to you. Ready? Finger, penny, blanket, lemon, insect.
Finger, penny, blanket, insect.
Excellent. Complete this with your athlete in a total of 3 trials and document the score. The next part of the test is going to be testing your concentration. I'm going to give you some numbers, and I want you to repeat these numbers backwards. So if I give you, for example, the numbers 1, 2, and 3, you would repeat back to me.
3, 2, 1.
Excellent. Let's start. 3, 8.
8, 3.
6, 2, 9.
9, 2, 6.
4, 1, 7, 3.
3, 7, 1, 4.
Good. Now can you say the months of the year backwards for me, beginning with December?
December, November, October, September, August, July, June, May, April, March, February, January.
Great. Excellent. These tasks evaluate attention and working memory. Next, we're going to perform a C-spine assessment. So first, I'm going to ask my athlete, do you have any neck pain right now?
No.
Perfect. And if I go ahead and palpate a couple places over here, do you have any pain or tenderness in the areas that I'm touching?
No.
Good. Okay. So now that you have no pain, I just want you to see, move your neck to the left and to the right, turn, good, and look up and down. Good. Any pain with those movements?
No.
Excellent. Now try touching your ear to both your shoulders. Good. How was that?
Good.
Excellent. And everything feeling normal. Let me see your hands. Go ahead, squeeze my hand, squeeze my hand. Sensation, everything feel the same on both sides. Good. If I touch here and here, it feels the same. Excellent. All right, next we're gonna just check your eyes. Do me a favor and try to keep your head as still as possible and follow my finger with your eyes, okay? Good. Here we're just trying to check for normal eye movement, make sure there's no nystagmus. Good. And go ahead, tell me when you see my fingers. Good. Excellent. So now I'm going to test your coordination. So go ahead and sit comfortably in this chair with your eyes open and your arm outstretched to the side, shoulder flexed. Excellent. Now pointing in front of you, when I give you a start signal, I would like you to perform 5 successive finger to nose repetitions until your index finger touches the tip of your nose, and then return it back to the starting position as quickly as possible. And you'll switch both arms. Ready? Go. Good. Excellent. All right, next we're gonna see how your gait is. So what I'm gonna have you do is walk heel to toe along the straight line, and then you're gonna turn around and walk back. Ready? Go ahead. Good job. So earlier I gave you a list of words that I wanted you to repeat for me. Could you do that now and repeat some of those words? Anything that you remember in any order.
Finger, penny, blanket.
Good. So now I'm going to test your balance. So please take your shoes off and roll up your pants, but you have shorts on, so that's fantastic. So this test is going to consist of 3 20-second tests with different stances. The first one's going to be a double leg stance. So first what I want you to do is stand with your feet together with your hands on your hips and your eyes closed. You should try to maintain stability in this position for 20 seconds. I will count the number of times you move out of this position, and I will start timing when you are set and have your eyes closed. My timer is starting. Good. Excellent. The next one's going to be a single leg stance. So you are going to be standing on your non-dominant foot. Which is your dominant foot?
My dominant is my left.
Excellent. So you'll be standing on your right. Now you should try to maintain stability for 20 seconds. You're going to have your hands on your hips, your eyes are going to be closed, and you're going to go ahead and lift up that other leg. And I will be counting the number of times you move out of this position. If you stumble, open your eyes. You can return to the start position and continue balancing. I'm going to start the time now. Go ahead and close your eyes, leg up. Perfect. 20 seconds. Good. The last one we're going to do is you're going to stand heel to toe with your non-dominant foot in the back. Your weight should be evenly distributed amongst both your feet. And you should try to maintain this position for 20 seconds, again with your hands on your hips and your eyes closed. I will be counting the number of times you move out of this position. If you stumble, open your eyes and return to the start and continue balancing. Ready? Excellent. Good job. In this section, you're going to fill out which foot was tested on your athlete, on what surface, and what footwear they had on. In the next section, you're going to score their stances and give a total of errors on the bottom. Errors include opening the eyes, lifting the hands, stepping, stumbling, moving the hips more than 30 degrees, or remaining out of position for more than 5 seconds. To conclude the SCAT6, you are going to score your athlete in the categories of testing above, including orientation, immediate memory, concentration, delayed recall, and finally make a determination based off of these tests if there was a concussion diagnosed for your athlete. Once completed, you can fill out the healthcare professional attestation. The SCAT6 is one component of a comprehensive concussion assessment. It should not be used alone to diagnose concussions. Clinical judgment, serial examinations, and return to play guidelines are also essential.